Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, psychiatrist and internal medicine physician. Today's Kevin MD article is Physician-Patriots, the Forgotten Founders Who Lit the Torch of Liberty. Muhammad, welcome back to the show.
Thank you very much for having me today to talk about this timely topic about our forefathers, the physicians who lit the torch of liberty.
All right. What's your article about?
So, in few weeks, this is 2025, we're going to be celebrating the 249th Independence Day. Next year, it's going to be 250 years. Our country is going through a lot of turmoil. The Constitution at times is being ignored. We are finding that the liberties are being encroached on, and people are just trying to figure out what's going to happen. Is the Constitution will just a museum piece, or is it going to be something that's going to be continued to be honored? But people forget that we as physicians have a sacred role in being able to act on this. Of the 56 signers of the Declaration of Independence, five were physicians. Those were Dr. Benjamin Rush, Dr. Josiah Bartlett, Dr. Lyman Hall, Dr. Matthew Thornton, and Dr. Alvar Wolcott. So out of 56, there's five, 10%. And we know now that we as physicians are activists. We know that there are 21 members of Congress who are physicians also. So this is our role for us as physicians, as practicing physicians, as men of science, as men of healing, men of vision, that we are going to help our nation in this turmoil that it's going through. And these physicians that signed the Declaration of Independence, it wasn't just the signature, it wasn't just signing this document. They risked everything. They risked their name, they risked their livelihood because the British monarch could have hung those who signed the Declaration of Independence, kind of asking to secede from England. So this was a great risk for them. And we as physicians right now, we are risking everything in the practice of medicine, prosecution, persecution. Insurance companies are curtailing the roles of physicians. Health systems have all physicians employed. 80% of physicians are employed by health systems. So where our independence is going, and I think it's our time to remind ourselves of our role and to continue to speak up.
So, take us on a little history lesson. You mentioned that there were five physician signers of the Declaration of Independence.
Yes.
So, what are some of the significant ways these particular individuals shaped the Republic? What were some of their contributions beyond signing the document?
Sure, sure. So Dr. Benjamin Rush, I'm a psychiatrist, so I speak specifically about Dr. Benjamin Rush. He is the father of American psychiatry. He actually established the American Journal of Psychiatry. He wrote the first book about treatment of psychiatric illness, though a lot of the things that he proposed were not used anymore. They didn't have a lot of things that they could use for treatment, but some of the things that he proposed, he says psychiatric illness is related to diseases of the brain. So he was able to identify that the brain was the source of psychiatric illness. He was also a humanitarian. Now, sometimes people just argue that even though he was a physician, some of the things that he proposed were worse than the disease. So in his time, there was the yellow fever epidemic that happened in the Philadelphia area. And he proposed a treatment that was called bloodletting. So basically, they would cut the vein and they would let the person bleed out, which turned out to be worse than the illness itself. So there's some parallels because we've had a pandemic. We had the COVID pandemic, and some people argue that the COVID vaccine may have been worse than the pandemic itself. So, but we propose treatments or we talk about things or offer treatments. That's the best that we could offer in our times. But Dr. Benjamin Rush died as the founder of American psychiatry. He's actually buried in Philadelphia next to Benjamin Franklin. Dr. Josiah Bartlett was actually a physician and he was the governor of New Hampshire and he practiced in New Hampshire. Dr. Lyman Hall is from Georgia. He established the University of Georgia. He practiced, and he was a healer in Georgia, and he signed the Declaration of Independence. Matthew Thornton was actually a surgeon in the Continental Army, and he was in Connecticut. And Oliver Wolcott was also a surgeon, and he was a soldier in the Continental Army, and he was also a signer of Declaration of Independence. So these were practicing physicians that utilized their ability to work with patients. And we call on physicians who are in active political roles because we may need some constitutional crisis counselors. And this is how we can act. We as physicians, we as our nation is facing this crisis, we can act and intervene and talk on behalf of our patients, on our behalf, and on behalf of the American population.
So you make that connection between the risk that these physician signers took in the past and the fact that physicians today were being disempowered, some are being silenced, and some are being indicted. And I think that you've told your story in the past. What are some ways today that the physician members in Congress can keep physicians free, to continue the metaphor?
Sure. So we have to speak up. I think you're lauded. You have this blog where you talk about physician issues. You bring that up to the public, but we need to continue to speak about it. And I give an example. This surgeon resident, Dr. Eitan Heim, we've talked about him. He was actually prosecuted and indicted by the Department of Justice for speaking up about gender affirming care and his wanting to ensure that it was medically appropriate and being applied appropriately. He was prosecuted by the Department of Justice. Later on, his charges were dismissed, but he was ordered by his judge not to speak about his case, even though he took his case to Twitter, wanted to talk about his case, wanted to advocate for his patients, wanted to protect those young patients who had unnecessary gender affirming care. We also know that, for example, there's a surgeon, Dr. Potter, who spoke about her interactions with insurance companies. And she recorded on Twitter and on Instagram where she talked about being called off from a surgery by an insurance company to be told that the surgery was denied. And this was a survivor of breast cancer. The patient was a survivor of breast cancer, and she was going to be having reconstructive surgery. And before she was put to sleep, the surgeon is being called by an insurance company and being told that the insurance company is denying surgery. So speaking up for our patients is very, very important. We also have the responsibility to continue to point to areas where the justice system, where other institutions are not being fair with physicians. For example, another physician, Dr. Christopher Russo, who goes on Twitter and he actually pinpoints sometimes the injustices that are being applied to other physicians. And he puts memes of the Justice Department and different U.S. attorneys' offices about the injustice and about some of their actions that are unjust with physicians. And that's been effective because I've just learned that they've cited his memes and his tweets in a briefing to one of the courts. So it is being effective. We are being heard, and continuing to talk about it, I think, is very, very important because that's how we affect change.
You write in your article that today the metaphorical battlefield is not Lexington or Concord. It is the clinic, the hospital, and of course, out on the internet addressing the public and in the courtroom. So physicians normally aren't trained in terms of this communication battlefield, so to speak. So what are some ways that they can speak out when that's not something that they're likely to do or something that comes naturally to them?
We have to seek training. I mean, we have to seek training about public speaking, and we have to start somewhere. People could start with blogs, should start with recording small, short videos, either on YouTube. For example, LinkedIn as a platform now sees that there's 30 to 50% of the messages that are being conveyed by participants are through video. So we could record video, we could practice, we could refine our message. Media training, for example, 15 years ago, I went to Discovery Channel and took some media training, 2 days of intense media training about how to talk to the public, how to talk to patients, how to talk to politicians. So that's very important. And so we are, as physicians, we should be seeking media training, understanding of how do we speak to the public, how do we speak on behalf of ourselves as a community of physicians, and practice, practice, practice. And we are seeing that there's some changes. We are seeing a lot of physicians that are talking on behalf of themselves and on behalf of their patients. There's multiple community. Your blog is wonderful. Physicians on social media, SoMe Docs is speaking. So there are multiple avenues for physicians to speak up, to advocate for their patients, to advocate for themselves, for their independence, and for their ability to continue to be a source of information. Because of the significant amount of misinformation that's out there, the public is looking for us to be able to provide that role. And unless we are on social media and talking to the public, we're not going to be effective.
I think that last point really resonates because if physicians aren't the ones on the internet or on social media, there is going to be others who may not be physicians or others who do not have physicians' best interests at heart taking up that space. Now, there are some doctors who say that they may not feel like one person makes a difference. So tell us some success stories where physicians got online and really made a difference in preserving our rights.
Sure, sure. So for example, we talk about Dr. Itan Haim. If he hadn't brought in his case up to the media and talked about it continuously on Twitter, it wouldn't have gotten the attention of the new Department of Justice, and he would actually been prosecuted, and he would have ended up not being exonerated from the fact that they accused him that he had a criminal HIPAA violation, which wasn't the case, but he was exonerated. His case was dismissed. So actually his speaking, he's a younger physician, he's a resident. So he actually proved that you can actually make a difference. I go on the waves on Twitter, on YouTube, and I talk about the unjust prosecution of physicians on a regular basis. And in fact, me speaking about it, the Department of Justice recently actually quoted some of my YouTube talks. In fact, they specifically quoted your YouTube podcast in a legal brief. So we are making a difference. They are noticing and they know that we are making a difference. And sometimes this is very positive because the justice system is hearing that we're talking about these issues, pointing out to the injustices that's happening to physician, and we're hoping that the public is going to notice that. The private physicians are disappearing. It's only physicians who are employed by venture capitalists or physicians who are employed by health systems. The private physician is nowhere to be found anymore. And unless we speak about that phenomena and we draw attention to that, the hospital conglomerates, rightfully so, and the venture capitalists, rightfully so, are just going to eat all of our rights and they're going to speak on our behalf. And unless we speak, nobody's going to hear about us.
Well, you are the one physician who has actually stood up to the Justice Department. But can we expect physicians in general to have that same gumption to do what you did?
And this is why I'm bringing you the stories of these patriot founder physicians. They stood up to the British king at the risk of being hung. I mean, he could have basically for signing that parchment that was read around the United States. They were risking everything, their family being arrested or being hung. So sometimes people have to risk grave things just to speak up and be able to portray the truth. And I hope to speak about my case in front of Congress, hopefully in the next few months, to talk about how we physicians, how the rules are being flexed in a way to prosecute physicians unjustly, and how the laws and regulations have become so, we became so ensnared in the laws and the regulations that it's very difficult to practice, that sometimes even normal things that you do in regular practice may put you at legal risk to being prosecuted. So speaking about it, we're gonna get the message to the Congress, to the legislators, and hopefully to the American public to draw their attention and to get sympathy to our plight as physicians trying to serve the community.
We're talking to Muhamad Aly Rifai, psychiatrist and internal medicine physician. Today's Kevin MD article is Physician-Patriots, the Forgotten Founders Who Lit the Torch of Liberty. Muhammad, as always, let's end with some take-home messages to the Kevin MD audience.
Absolutely. We physicians, we are still here. The Constitution is not dead. The Declaration of Independence is not obsolete. They live in us, in our hands, in our clinics, in our hearts. And to those who want to silence us, know that we are descendants of physician patriots. We're not afraid. To our patients, we will not abandon you. We will stand by you. And to our fellow doctors, we call on you to stand up, reclaim your voice, and remember your power. And Dr. Benjamin Rush, the fire that you lit still burns in us. Thank you.
Muhammad, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.